Hello, 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 and welcome back to the IBS Freedom Podcast, your favorite podcast. Let's just admit that right out the get-go. I'm Nikki. I'm, of course, joined by Amy, my beautiful co-host, and you'll notice there's another person on screen for those of you on YouTube. So I'm going to let Amy go ahead and introduce our special guest for today, and then we'll get rocking and rolling with the super special topic with the super special guest.
Yeah, so this guest, again, because I just had a baby, I've been dealing kind of with some postpartum issues, and her content's been really helpful for me personally. And then again, because I'm learning a little bit more about OCD and anxiety and things like that, I really wanted to bring her on because I felt like she could be really helpful for a lot of our listeners. And again, just a little bit about Jenna. Her name is Jenna Overbaugh. She's a licensed professional counselor who has been working with people who have OCD and anxiety since 2008. Her work includes experience at all levels of care, including 8 years working at a residential recovery unit for OCD, working with some of the most debilitating cases of OCD in the world. She has spoken at national conferences, has published empirical research articles about OCD, and has been featured on the OCD Stories discussing both her professional and personal experience with OCD. She also has an awesome podcast called All the Hard Things. And again, her Instagram's great, at Jenna Overbaugh. Is there a space between?
There's a dot.
Okay.
Jenna.Overbaugh.
Okay. At Jenna.Overbaugh. And we'll link to things. And then again, she does a lot of work through the No OCD. Is it an app or it's an app, right?
Yep. So No CD, it's kind of confusing. So we kind of call ourselves No CD, but the free app is called Treat My OCD.
Okay.
Treat My OCD is the free app. We can talk about that too a little bit, but free app, free to download. But then No CD is kind of like us as an entity. We also offer therapy.
Oh, cool. Yeah, I think the interesting thing about me with postpartum stuff is ever since I've kind of gotten diagnosed with postpartum OCD, it's a lot of things make sense throughout my life. Mm-hmm. It's so strange. And
that's exactly how it goes.
Right. We've talked about this on the podcast, how we've always said, if I'm dysregulated or off, I kind of lean more anxious and Nikki leans more depressed. We've always been very open about that and talked about that. Mm-hmm. But I guess throughout my life, I've always had weird episodes of intense, what I thought was intense anxiety, but it was never a consistent thing. But yeah, ever since postpartum and even before the baby, I had some stuff popping up, when I was pregnant, having some OCD stuff popping up. Yeah, it's just so weird. It's like shit makes sense in a weird way. That's kind of how it feels. It's oh my gosh, I was talking with my therapist about being 9 or 10 and having this recurrent fear that my sister was going to be eaten by a shark, when we were going on vacation. And every year when we'd go on our family vacation, it would resurface and it would just be me sitting up at night with the recurring thought of oh my gosh, this is so intense. And then each night being okay, one night's down of this trip, we only have 6 nights left to go. But just little instances like that throughout my life where I'm oh, that was very OCD of me. But not really the typical OCD presentation that we all hear about where you're I don't know. I always think,
or maybe
unfortunately, of right, hand washing, ritual, physical rituals. Mine were all mental kind of rituals. So yeah, it's just super interesting when you go back and you're whoa, all these weird instances of more intense anxiety where it was actually probably more OCD that led to the heightened anxiety. But yeah, I'm super excited to have you on because we've been talking too, about our clients. I've been through a health journey and I think I had a lot of health OCD going on during my gut journey, with IBS and gut symptoms where, you're hypervigilant, you're really freaked out of foods, you're avoiding a lot of foods for fear of symptoms, or we have a lot of clients that, might avoid going to social situations for fear of diarrhea or something like that happening. But we have, again, a lot of clients where, they're struggling to progress and they have real symptoms. I think we talk about some of this stuff. Sometimes they're oh, you're just saying it's in my head or something mental. And it's for me with my health OCD, there was definitely gut issues, but the health OCD made things so much harder.
For sure.
and made things like so much worse and kind of disconnected me from my life, which prevented me from getting better. And naturally, I kind of re-engaged, and that helped. Like, I kind of found my way to not avoid on my own eventually. Like, after a couple of years of being pretty intense, kind of was like, oh, whatever, I'm kind of exhausted of doing this. I'm just going to like re-engage in living. And that kind of was how it ran its course for me. But again, we have a lot of people in that cycle. So again, we've been talking a lot more about it, and we're like, oh yeah, like we have this client and like this patient that's kind of having some OCD-ish stuff that we think might be really preventing them from moving forward. So
yeah,
again, that's why we're like super excited to have you on, because I feel like a lot of people don't know about OCD, or maybe the difference between health anxiety or OCD, or is there a bigger difference, or what is it kind of, how would you describe OCD or health OCD in general?
Yeah, so one of my favorite topics ever, this would have to be like its own separate podcast episode, and I've talked about it on my podcast, but is there a functional difference between OCD and anxiety? And at the end of the day, I don't really think so, right? Like the way that they work and the way that they are, established over time and reinforced by behaviors are exactly the same. The treatment for it would be largely the same. I think if anything, like a lot of times people, their reaction is like, well, generalized anxiety disorder isn't as intense as OCD. And it's like, yeah, but who am I to say that this person who has really significant GAD and this person over here who's like just in the beginning of their OCD symptoms, I can't compare their severity. I don't know enough about that situation. So sure, I can believe right now they're categorically separate in the Diagnostic and Statistical Manual. OCD used to be an anxiety related in related condition. I think the DSM crew made a mistake in keeping it away and taking it away from the anxiety related conditions. So right now, obsessive compulsive and related conditions are kind of one category, whereas anxiety and related conditions are another category. A lot of us don't necessarily agree with that. But I would agree that instead of them being categorically different, they more so probably exist on a spectrum of some sort. I don't know what spectrum that might be, whether that's severity, whether that's the vividness of the thoughts, whether that's kind of like the down to earthness of the thoughts, right? Like for the longest time, we kind of thought that OCD was about irrational things, and it was all these kind of like outlandish things that could never happen. Like I'm washing my hands 80 times so that I don't get the sniffles. It's like, that's not always what it's about. Like a lot of times we are having obsessions and compulsions about things that could happen.
Right.
Like I did have an intrusive thought about dropping my baby down the stairs, or I am obsessing and compulsing about COVID, which is a real thing, right? So I think just as evolution occurs within our field, right? Like we're learning more and we're becoming more clear. But to answer your question, I don't think that they're functionally all that different at all.
Right.
I mean, the biggest pieces there are that there are these intrusive experiences, these doubts, these uncertainties, these worries, these unpleasant kind of like unknown experiences that we all have as humans. But when you're more vulnerable to OCD and anxiety, you tend to have some cognitive misappraisals of those uncertainties and those doubts, right? So you tend to think like, oh my gosh, I had that thought, therefore I have to do something about that. Oh my gosh, if that happened, I wouldn't be able to tolerate that. Oh my gosh, if that happened, that would be the worst thing in the world. I have to do something about this now or else ... And so then you can imagine there's a lot of anxiety there. And then the kicker, right? And in generalized anxiety disorder, they call it safety behaviors. In OCD, we call it compulsions. They work the exact same way. So call it, tomato, whatever you want. But it's this thing that you do. And Amy, you mentioned this so beautifully. Like a lot of times we thought that OCD was just these very overt compulsions, like hand washing or checking. But you can do anything as a compulsion. Like if you're doing it repetitively, and you don't actually want to be doing it, but you feel like you have to do it out of anxiety or else something bad will happen, it's a compulsion. And so it could be reviewing in your head all of the awful ways that your sister could die by a shark and calculating how many days left you have on vacation so that you can just get the heck out of there, right? Like, and so you do these things either behaviorally or mentally to make yourself feel better. and to mitigate or neutralize the anxiety from the obsession or the uncertainty. And it feels better temporarily, but it just reinforces that for next time. So for instance, somebody who's fearful of going out because they're worried that their IBS will act up, let's say they stay home, right? They stay home. That probably alleviates their anxiety in some way. Oh my gosh, thank goodness I didn't go out because I didn't, have a flare up and I didn't have this like situation happen at this party. Thank goodness I didn't go to that party because otherwise something bad would have happened. We don't know if something bad would have happened or not, but our brain is interpreting that. And so next time we are invited out, our brain remembers, oh, but you were safe last time you stayed home and something bad would have happened the last time you left. So you better stay home. And so these safety behaviors and this avoidance, it just reinforces everything for next time. And that's why, subtle things like avoidance and any ritual, whatever it is that you're doing, it might make you feel better in the moment, but in the long run, it just makes you more fearful and it gives your brain the message that you can't tolerate that.
Right. Like for me personally, what I tend to do, I always explain this to my therapist. It's like I'm like a lawyer and like giving a counter argument to like this wild idea. And I kind of label it as like a crackhead. Like this crackhead is throwing out wild stuff. And I'm trying to rationalize with this crackhead in my head with these like intrusive thoughts. And it's like, there's no way that you can rationalize with this person. But I was trying my darndest,
Because that person has no interest in wanting to understand where you're coming from, right? Like there's never going to be a situation where you can logic your way out of these things because this exists, these anxieties, right? These uncertainties, these doubts. Oh my gosh, what if this happens? What if this happens? It all exists in our imagination. And so we can logic our way out of that all we want. Well, you were fine the last 1,500 times you went to a party.
Right.
Well, what about this time? Right? Like there's always going to be one more, but what if? Imagination will always trump logic. And that's why we can't logic our way out of anxiety or obsessive compulsive thoughts. I love that metaphor, by the way. I've never heard that before. Like, yeah, you're trying to be a lawyer.
Right.
And it's like, I always say it's like you're negotiating with a terrorist. It's never going to work.
Exactly. It's like, again, I call my OCD crackhead Steve. That's kind of my like way I describe it. I'm like, well, crackhead Steve is telling me all this wild stuff. And I'm just like, have to kind of be like, okay, hey, crackhead Steve, like I'm going to move on and like go this way and kind of ignore you. But yeah, I think again,
I love that.
And to me, it's like, would you reasonably, like if there was a crackhead on the street yelling crazy stuff at you, would you reasonably try to like go up and say like, no, that's not true, like sorry? And it's just, you can't reason with someone that's not rational. And again, that's just exactly how OCD is. But yeah, it's funny. I remember too, like there was some stuff during pregnancy that would come up. I remember, and this is a good example, and I think like some stuff before I had her was definitely more like health OCD-ish that would come up, like if I had to pick a subtype for it. But I remember I went to a wedding and I danced really hard at this wedding. And I was like, oh no, did like I jostle her head in there? Like did her head like hit my pelvis or something wrong? And I remember like the next like 3 or 4 days, I was viciously researching, seeing like pregnant people dancing and like how safe it was. And like, but there was always continued question. Like, again, like I don't feel like it relieved. There's always like a little bit of a doubt in your head. Like, I don't know. I can't be totally sure that my wild dancing to Footloose at this wedding, like didn't hurt my baby. She's totally fine. But like, again, that's
you can read all the articles, right? Like I think so many times people with OCD and anxiety, and again, I use those terms kind of interchangeably because at the end of the day, it's whatever to me. But I think so many times when we're in the pursuit of that certainty, right? Like we really believe that like there's an end goal.
Right.
Like I'm going to find an article that makes everything feel better. But it's like, literally, you know that you're going to look at that article and it can say everything that you want it to say. And it might feel better for like 2 seconds, but then you're going to be like, but wait, I don't know if that article was talking about how hard I could be dancing. Were they talking about how hard I was dancing?
Yeah.
Because maybe that article was just talking about like slow dancing.
Right.
Right. So it's like we're always looking for this, we're in this hot and desperate pursuit of an answer, and it's never enough. Like OCD just keeps raising the bar. It just
Right.
raises the bar and raises the bar.
That's a good way to put
I
it.
think of OCD kind of like Charlie Brown and Lucy. Like Charlie Brown always wants to, like at the end, right? Like at the end of every Charlie Brown episode, Charlie Brown would go to try to kick the football. Do you guys? You guys have to know what I'm talking about. Okay. I feel like people don't like remember Charlie Brown half the time anymore.
Depends what generation you talk to, but I think we are old enough.
Right.
We're both in our 30s, so both of us are old enough to remember Charlie Brown, thankfully.
So at the end of every episode, right, or most episodes, Lucy would like taunt Charlie and be like, "Hey, Charlie, like, hey, come and kick this football or whatever." And Charlie, you know, with the best of intentions and trust and whatever, would go and kick the football, and she would always take it out from him, and he would always land on his butt, and you know, she got him again. She got him again. And then the next time she would be even more convincing, and he would try again, and he would always do that. And in one article, Charles Schultz said that like Lucy was never going to let him do that. Lucy was always going to just keep raising the bar.
Right.
Lucy was never going to let him have that moment. OCD
Clearly.
is the exact same way. There's nothing that would have existed to appease that fear.
Right.
There's nothing out there that would have existed.
Right.
Well, it makes me think of some of the people that we work with, and we've kind of talked about this a little bit the last few weeks in particular, but like I was sharing with Amy that I've had some patients who they are constantly seeking reassurance from me.
Yes.
In the flavor of like, are you sure I'm not too much of a lost cause to help? Are you sure you can help me? Is there hope for me? Am I ever going to get better? Oh my God. Are you sure you can help me? This is like months into working with somebody, and they're still asking me like, are you sure you can help me? And it's like, dude, yes, I wouldn't have taken you on as a patient if I thought I wasn't going to be able to help you. Just chill out. But
And then they ask again.
Right.
And I remember there was this one lady who, you know, she was doing that every single appointment. She was seeking that reassurance and asking like, are you sure I'm not a lost cause? Are you sure you can help me? Are you really sure you can help me? Am I just too far gone? Am I ever going to get better? I don't know. I don't think I'm going to get better. And I remember pointing out to her at one point, I said, look, and I now know from talking to Amy about OCD that this might have been the wrong take to have. But I said, look, I will give you the reassurance when you ask for it. And like, I will give you my honest opinion every time. Like if I reassess the situation and I don't think I can help you, like I would give you an honest answer, but realistically, I don't see that happening. Like I will keep giving you the reassurance that you're on the right path and you're going to get better as many times as you ask for it. But I think it's worthy of acknowledging that the big problem here is that you don't believe it.
Right.
So I can tell you 8,002 times that you're going to get better, you're going to get better, you're going to get through this. But if you don't believe it, you're still going to come back to me for number 8,003 and repeat the same cycle.
Right.
And I think that that's worthy of exploration, that like you need to believe it before my words actually have value for you. And I don't know like what else I can do to help you with that, but like just FYI.
And if asking for reassurance was helpful, then why are we still doing it, right? Like if that, so I can see where Amy was coming from.
Yeah.
I don't expect anybody else to know that though, right? This is why it's also so hard to work with like loved ones, because everything that we do goes it's such a paradoxical approach, right? Like people will ask me the same thing, like, are you sure that you can work with me? Are you sure that I can get better? And I'm like, you know what? I really don't know. Like, I hope so. Like, I know that this treatment works for most people. And I know that, you know, where we're at here right now, like things seem like it went okay. But, you know, I think the more that you ask that, the more upset you're going to get. So let's just focus on like, that seems so cruel.
Right.
But, you know, again, like that person could come to you. Like, if it was helpful, then why do we keep doing it? It's not helpful.
Right. Like maybe one time or
like,
something, but like if it's a repeated pattern of constantly looking for the reassurance,
or like if there's some new diagnosis too, like I could see a situation where somebody initially comes to me with like IBS, and I've had this happen, like people, you know, like I had a lady who got diagnosed with melanoma. And then that threw us for a little loop. And she was like, whoa, this is completely different and new. Like, do you think you could still help me with my gut, considering that I'm going to be undergoing chemo and radiation and doing all this other stuff? So like when there's really new information, like that level of information, I could see kind of checking back in and reassessing and saying, hey, do you still think that we should proceed working together? But again, these are like, and I've had this happen with other patients as well, where we're still working on the same thing that we initially sought out to work on, like the IBS or the SIBO or the reflux. And it's like, there's no new information that would indicate to me that you're like too far gone to help. And yeah, it's like, if reassuring you constantly was helping, it would have already helped and we wouldn't be doing this again. But it seems so counterintuitive and also like just mean to deny somebody the reassurance. I want to be like the mother hen type and be like, there, you're going to get better. You could do it. Come on, I'll be your cheerleader. So it's been a little bit of a pardon the expression, but it's been a little bit of a mind fuck.
Yeah.
Getting to know
100%.
the difference between like run-of-the-mill anxiety versus this OCD, because I think a lot of people that we work with have some degree of the OCD stuff going on. And it's like, it makes you look at things like food fear and seeking reassurance constantly, or the people who always want a new test.
Right.
Like, okay, like let's test for leaky gut again.
Right.
Or let's reassess the microbiome again. Or let's do a SIBO breath test again. And it's like, but you're feeling better.
Right.
Shouldn't that indicate to you that the SIBO is gone? And all right, I said I was going to be in sponge mode, but now I've got a tangent, if I may. I throw my profession under the bus pretty much every episode. So here's my moment here. I feel like part of this is in part due to my profession, like the functional medicine and naturopathic world, because what happens is we get told from people on the internet and people in this world, we get told, test, don't guess. And people will be like, oh, I went to this functional doctor with eczema and no gut symptoms whatsoever. And then I got diagnosed with H. pylori or SIBO. And like, I had no idea there was a boogeyman in my gut. Who knew? And like this kind of stuff, like test, don't guess. And like these things kind of teach people to not listen to their body and not trust their body and seek the answers in the form of the testing. And I think that unfortunately functional medicine has maybe steered us in that direction a little bit harder than we really needed to go. I mean, sometimes you find surprising stuff on testing and it can be useful. I'm not saying it isn't, but I think honestly, like the functional medicine profession has probably exacerbated a lot of OCD in a lot of people, unfortunately.
Well, I think to coincide with that, I think a lot of times too, when it comes to the medical profession, a lot of times, there is medical gaslighting that takes place, and there's this like denial of blood work when people want blood work. And it's like, we hear a lot of like, well, advocate for yourself, like find a doctor who wants to work with you. And that's great. Like, that's fine. Like there's no one behavior or one manifestation like that's inherently good or inherently bad, right? Like someone can go and advocate for themselves when one doctor didn't give them a good enough answer. And I would be okay with that if I knew this entirety of the situation. And in someone else, depending on their situation and their background, that might be completely obsessive compulsive. And I would say, you need to not get that additional test. You need to chill and you need to sit with it.
Right.
Yeah.
So people are just so complicated. There's no like one slam dunk, like this is bad and this is okay. It comes down to, I think, like how much of this is influencing your life? Like how much do you want this to be, negating your values? Like how much time are you spending on these tests? How much time are you spending on your thoughts about this stuff? Like, is this how you want to be living your life? And I always challenge people to consider too, like, is this the best way to solve this problem? Like, if the problem is, I'm not sure if this will work for me and I need a little bit more hopefulness about my situation, I would say that probably not asking the same question 850 times is the way to do it. Because if you've done it 850 times, it's probably not helpful, right? So OCD has a very strange way in a very sneaky way of making the person think they're problem solving, but they're not actually problem solving.
Right.
Problem solving is very trial and error. It's very much like, I'm going to try this and see what happens, collect evidence, and then try something different. OCD is like, it's called perseveration. It's where they literally perseverate on the same thing over and over again. I'm going to totally nerd out here. I've never talked about this on the podcast before. This is such a nerdy thing. This is what it seems like people who you work with do. So there's actually a fun test. Anyone can go and do it. It's like a game almost. It's called the Wisconsin card sorting test. And I love it because I'm from Wisconsin. But you can go and you could easily like Google an image and see what it looks like. But it's essentially a card sorting test. And it measures a couple of different things, but it mostly measures like executive functioning, which is been shown numerous times to be very heavily implicated in obsessive compulsive disorder. But essentially it's a card sorting test, and you have to guess, you get this card and you have to guess which category it belongs to. Does it belong to the shape category, the color category, the number category, or some other category? And it's very ambiguous. You don't know if you got it wrong. There's only one right answer, and you don't know if you got it wrong. You just get the ambiguous answer that it wasn't right. I know I'm probably not explaining this the best way, but I would encourage anybody to like look it up. But the whole point is that people who have OCD, they'll get feedback that it was the wrong choice. And instead of moving on to another option, like other people do who don't have OCD, people who have OCD will get feedback that it was the wrong option, and they'll continue to pick it.
Yeah.
They'll continue to pick that.
Oh my gosh.
To just be 100% sure that that's not the right answer.
Huh.
So whereas somebody who does not have OCD is like, okay, that was wrong, I guess. I'm going to choose a different option. Somebody with OCD, they will perseverate on that. They would rather be 100% sure that this is not the right answer before they go on and move on to a different solution. And there's lots of research to show that with the Wisconsin card sorting test, and people who have OCD take so much longer to do the Wisconsin card sorting test and to get through everything. And like they freeze a lot more. They do like more perseverative clicks on the same wrong card than others. It's really fascinating because it's so silly, but we see that, right? Like that's what you're telling me, is that this person, they have a problem, and it could be with whatever problem, right? But they're perseverating on this problem they're perseverating on this solution rather of, I'm just going to keep asking for reassurance. I'm just going to keep asking if there's hope for me, if there's hope for me, if there's hope for me, if there's hope for me. And that's very obsessive compulsive, to just continue to do the same thing over and over again, instead of being able to say, I got the feedback that that's probably not the best way to go about it, and I'm going to try something different. Yeah. That's functional, and that's what we want people to be doing.
Yeah.
And I have something to throw out. Now, I know, Amy, I think you've seen part of the series, but not the whole thing. Jenna, have you ever seen The Good Place?
No.
Okay, first of all, people, watch it. It's so good. But there's a character who, like, is much more high-strung and anxious, and looking at it now, he probably has OCD as well. And at one point in like midway through the series, I think he describes his brain, because like his thing is that he can't make decisions. Like because he's thinking about all the possibilities and all the ethics, and like
probably wants to be 100% sure about his decision.
Doing the right
the more that you
thing.
think about things, the less confident you get.
Yeah, and he's always like noodling on stuff, but to a point where that's like one of his major character flaws, is that he can't make a decision to save his life. And at one point in the series, for people who have seen this, it's Chidi Anagonia, of course. But he mentions that his brain, he's like, the sound when you get like a fork stuck in the garbage disposal and it's just like that metal grinding on metal. He's like, that's happening in my brain at all times. And if he's trying to make a decision, like the metal grinding on metal just gets like that much louder and that much more intrusive. But I thought that was a unique way to describe it. But yeah, it's almost like it's so interesting that you say that people will kind of repeatedly do the same thing. And I wonder too, there's so many implications with the people we work with. So like another one, and I've shouted this from the rooftops for years, is get off the damn Facebook groups.
Right.
Yes.
Like the
Get off of
the
Google.
SIBO groups, yeah, and Google, but like, you know, the Facebook groups, the SIBO groups, the IBS groups, the Reddit threads, and people will mine looking for answers or ask perfect strangers for medical advice. And like, sometimes there could be like a smidge of value in those, especially if you're first diagnosed with something like SIBO, you don't know the first thing about it, and you're just like, where do I begin? And you want to find some resources. Maybe like I could envision spending a day in one of those groups being valuable. But the more you go back and back again and back again, and oh, did somebody post anything new? And oh, is there a new supplement that somebody's talking about? I need to go get it right now. Or oh, somebody said that this
that
test.
desperate pursuit of like this hallelujah moment. Like, there's this North Star where like the lightning bolt of clarity is going to come and everything is going to get better. And it's like, no, like that's not how any of this works.
Right.
It's not how any of that
Well,
works.
and it's so interesting too, because I think something that you're touching on that I think could be really helpful, because a lot of the people that we work with, and I've been there personally with, I think now looking back, health OCD myself, is, and you were talking about it, like how much time and energy and resources are you putting into this problem that's pulling you away from living your life? Like it's all consuming.
Right.
So that's what we see with our clients at times, where it's like, oh, like they're not going out with their friends. Like they're constantly researching. They're constantly listening to podcasts. They're constantly, again, seeking out new information, trying to get rid of doubt. And then they're not engaging in the things that give them joy or the things that they value. And so again, like I've seen it with my own clients. And again, before we even really understood about OCD, I know Nikki and I have talked about this before, but like you have to get back to living your life. You know, you can't just be perseverating on this one issue, because again, like you're just going to create more doubt and more uncertainty. You have to kind of move towards your values more and more. And again, I know personally during my health issues, I had lost a bunch of weight and kind of got weaker. And there was a long period of time where I was like, well, I can't play basketball. I played college basketball for a stint. So again, like I played pretty high-end basketball in my past, and I kind of had lost weight and was weaker. It was just like, I can't play like a full game. Like that's going to be terrible. So for a while, I just avoided it completely. And then I was kind of like, you know what, screw it. I'm going to play like a quarter or a half. Like, again, it was just kind of building up my confidence to like, oh, maybe I can't play the whole game. That would be like too hard on my body, but I can play some of the game. And so that's kind of what I did. Can you hear us, Jenna?
Yeah.
Okay. Your videos.
Yeah, your video disappeared for
Right.
some reason.
But yeah, it's kind of like, again, like I just doing a tiny, like, again, a baby step in the right direction, I think's what people need to focus on a lot of times with things like health OCD, or like, you know, I know the diarrhea, like the fear of diarrhea is real, but like, how can you expose yourself? So maybe we could talk a little bit about like what you can do for things like OCD and anxiety. Oh, Nikki.
Can I interject for a second though, before I let poor Jenna speak? I think you just found the cure for all OCD. 2 words, screw it.
Oh my, yeah.
What you said at some point,
right? Like, obviously, I mean,
I'm joking, but like on some level, just
Right.
saying, screw it, I'm not going to check to make sure the front door is locked. Or
Yeah.
screw it,
I'm going to that party.
I'm not going to go on these Facebook
Right.
groups. I'm going to leave these Facebook groups.
Screw it. As much as I want to ask this question of my, the person that I'm working with, I'm not going to ask it again.
Yeah.
Right.
Episode title? Screw it. No, we'll keep it slightly more professional than that.
And I will say too, like a big aspect also for our clients is like the food fear. Like we have disordered eating, OCD-ish, and you can maybe talk about the overlap, but like talk about too, like doing the same thing over and over again, where people are like, oh, I need to keep restricting to control symptoms versus like, oh, I just need to experiment to figure out what foods work and don't work for me. What we run into is, oh, I'm not getting better, so I need to remove more and more and more and more foods. that's kind of the typical client for us, which again, is avoidance behavior, again, more orthorexic type behavior, I would say.
Right.
But yeah, there seems to be a lot of overlap with that too.
Well, and the hypervigilance thing too. Like I was talking to somebody recently about introducing new foods, and they were like, okay, so I should introduce a new one every like 5 days. And I was like, no, like you could go faster than that. Like maybe give yourself a day
Right.
for each. Like I think we were talking about FODMAP foods. So we talked about like how to do it and like the dose and like working your way up kind of gradually, because it's been 2 years since your poor body has seen garlic. So like cut it some slack if it's a little weird at first. But yeah, like similarly, this idea of like, I have to watch everything my body does and be super hyper vigilant, because if I get a single itch, it's a histamine reaction and it's a food allergy and oh my God, I can't eat it.
Yeah.
Or
100%.
like, or I've had people who say, you know, I ate X food and then I got a runny nose, therefore I have histamine intolerance. I'm like, no, I don't think you do.
Right.
Like,
Right.
And I think oh my gosh, there's so many overlaps, right? Like, so I worked in residential for 8 years, which means they were the most debilitating cases of OCD in the world, and they could not function. They could not take care of themselves. Their activities of daily living were so far debilitated that they needed 24/7 care. So they would come and they would live with us for 45 to 60 days. And because one of the ways that you'd have to meet residential criteria would be with food. So I've worked with so many people who remind me of kind of what it is that you guys are talking about, where it's like, oh yeah, I tried this new food. And so, I had this little itch or I had this little tingly. Now I can't have that. I worked with someone who for the past, at the time it was 5 years, they had only eaten all organic frozen Trader Joe's peas and a very like specific kind.
Right.
So like it got that specific, right? Like it had to be Trader Joe's, it had to be all organic, it had to be frozen, and it had to be like this very specified brand. And so that a very, very specific type of water, it was distilled, which is like, I think you're not even supposed to drink it.
Yeah.
Yeah.
And all organic Trader Joe's frozen chicken thighs. And so like she bathed in distilled water. She brushed her teeth with distilled water. She boiled all of her peas in distilled water. Like it was so extreme. And she was terrified that she was going to have an allergic reaction. Right. And so what we were going to do, right, like I had to work with her through exposure and response prevention and introducing new foods. And you'd think that it would be as simple as like, oh yeah, try strawberry. But it was like, no, she needed to try like all organic frozen peas from Trader Joe's that was a different brand that she was used to.
Right.
Yeah.
And then it had to be all organic frozen peas from another health food store that was kind of partnered with Whole Foods, right? So it's like, it could be that incremental. And it's like, if you take that long, you are literally going to be doing this for the rest of your life.
Right.
Yeah.
Right. Right.
By the end of treatment, we worked together for like a year. We were able to have like a wonderful Thanksgiving dinner together. We ended up having a pizza party before she left. We ended up having Halloween candy, which was really amazing. But it's like she did all that stuff and she never had an allergic reaction. She had anxiety, right? Like, of course, her like throat would constrict. That was always really difficult too. It's like her throat would constrict or she would get like red blotches on her chest.
Right.
And she would always be very convinced that that was an allergic reaction. And I'm like, let's just see what happens. I knew that it was anxiety, right? Like I knew that they're so common. And there's also this thing we're all, even if you don't have OCD, we all have a confirmation bias, right? So if we are looking for something, we're going to find it. And so consciously or not, if you are trying a new food and you believe that you're going to have this detrimental outcome and that you're going to have something up with your body and you're very vigilant for your symptoms and what your body feels like, you're going to find something that's wrong. I mean, if all of us listening right now were to just tune everything out and just pay attention to our body and do a full-on body scan, My head feels a little bit itchy. My knees feel really, really tight. I have like a sharp pain in the back of my lower back. My chest feels really tight. But that's not keeping me from doing the things that I need to do, right? Like that's not necessarily problematic. It is what it is, and I'm giving it attention. So of course it's there. So I think there's a lot that I could say, and I don't even know if I'm answering your question, but yeah, there's so much overlap.
Yeah.
There's so much overlap, and there's so many different just like mind tricks that are happening, and yeah, I mean, anxiety comes with a lot of physiological symptoms like nausea, like a lot of things that would mimic IBS issues, a lot of things that would mimic allergic reactions. It's really, really tricky road to navigate.
And it's fascinating because we've interviewed some people, like some therapists and other dietitians. And I remember like we interviewed a lady named Elena who works with disordered eating, particularly binge eating folks. And she was talking about her journey, and she was diagnosed with IBS and had a whole bunch of gut issues when she was like super hardcore dieting and doing a ton of cardio and trying to stay super, super skinny. And I believe she lost her period because she was like orthorexic and under eating. And then she was binging. And when she gained some weight, gained some muscle, like she started doing different kinds of workouts like weightlifting, like when she started just eating more intuitively and just eating what she wanted to eat and eating some junk every now and then, like her period came back, like she feels stronger than ever, and her IBS totally went away. And it's fascinating, but it's such a sticky situation because, like Amy mentioned, a lot of our clients and patients have been told either in a roundabout way or directly that, oh, you just have anxiety, or, oh, it's all in your head, or, oh, just take,
so triggering because it feels like so
take
real.
take this antidepressant, take this anti-anxiety med, you just need a benzo. And you mentioned gaslighting, like it's like, okay, well, crap, I guess I'm just a crazy person then. Like that's so unsatisfying and just rude and mean and terrible to tell somebody. But I guess what I've been saying for a little bit at least is that it's not to say it's all in your head, but the stuff in your head still matters. Right? Like
I always describe it as a piece of pie, like a pie, right? So, I can come into a discussion having one opinion that, yes, it's all anxiety and it's all in your head. And the other person is probably going to come at me with a completely opposite opinion of this is real and it has nothing to do with anxiety. I am anxious because of all of these things. And if I didn't feel all these things, I wouldn't be anxious. And we can always argue back and forth, but that's not the point. And I'm not here to get someone to see my side of it. So I always think of it like a pie. So let's just assume that someone's problem, with IBS, let's just assume that was a big piece of pie. And like a big pie. And let's just assume, as awful as that is for you, like I want to help you with those symptoms. I want, like, you want help with those symptoms. I want you to be helped with those symptoms. That must feel really awful. As far as the things that could contribute to that, maybe it is certain foods. Maybe it is certain lifestyle choices. Maybe we'll figure some of that out. But when we're working on OCD together, I think we could both agree that these behaviors and these things are probably not helping the situation, right? So even if the OCD and the anxiety and the mental piece is just a teeny, teeny, tiny little piece of the pie, we have to, and we can probably agree that it's at least exacerbating what might feel very, very real to you. And so I've never lost anybody at that. Like, I feel like every person can agree with that like their anxiety is at least exacerbating what feels very, very real to them. And so I always come at it from the angle of like, well, if I can help you with this thing that's exacerbating your problem and making it more uncomfortable than it needs to be, and we can kind of shave off, 20% of that discomfort or 50% of that discomfort, even 5% of that discomfort. Like, let's try to do it and let's see if that's helpful. So I always try to come at it, even if I have my own opinions about what is the problem going on. I always knew that woman who I referenced never had an anaphylactic reaction. I knew that she probably wouldn't. I mean, I couldn't guarantee my life on it, but I was fairly sure that she was never going to. We had no medical reason to assume that she ever would. I never told her that, right? Like, I wouldn't have gotten anywhere. I just always came at it from the area of like, well, yeah, we know that anxiety can cause these physiological symptoms and make us do things and feel certain things that are uncomfortable. Let's try to at least tackle the part of this pie that is exacerbating your distress. And that's usually pretty helpful for people. But yeah, I mean, it's really, really tricky.
Yeah.
It's all really tricky.
Well, and I think too, like probably the functional integrative space that we work in too is guilty of overemphasizing like the gut brain connection and the microbiome, and like that is driving anxiety. And there's this if your gut's imbalanced, that drives anxiety and depression and all these things, instead of looking at it as what it is, which is a bidirectional relationship. People sort of will say, oh, I just need to fix my gut, like what you're saying, and all the anxiety will go away. And it's like you have to see both sides or both parts of the pie, and not just get totally sucked in on like your gut symptoms and that kind of thing. But yeah, it's super interesting. I know too, I want to talk a little bit about like what to do, but I also want to point out something you had posted recently that I found really interesting was like some of the things that just don't work for OCD, like sometimes traditional therapy can be actually detrimental for OCD. I was laughing because you had posted recently that like sometimes positive affirmations can be detrimental to OCD. And during my pregnancy, I was doing like hypnobirthing, and there was a part of the hypnobirthing course that was like, you're supposed to listen to these affirmations every single day. And the message in those affirmations is like, you are your thoughts. Like you are like, which is the worst thing for someone with OCD to hear. It's like, oh, you are thoughts. Well,
you are Steve the crackhead.
Right. I am Steve the crackhead is the message that I was getting. And so I had like these vivid images pop up about like C-sections. Like I was really fearful of a C-section. So I had like literally an image pop in my head, which can also be OCD. It doesn't have to be like necessarily a thought, but an image of like, again, being sliced open, which is, again, wouldn't have been how a C-section went, but it was like a violent kind of thought. And again, like when that happened, I'm like, well, I can't think like that because I don't want to be my thought. Like, again, it caused more anxiety and OCD-ish behaviors because I was trying to like suppress it. Yeah. And because I was getting...
Well, don't think about it, right? Don't think about that. Don't think about that. Don't think about a white elephant. Don't think about a white elephant. You just end up thinking more about that. And so that's like very law of attraction, right? Like that, like you are what you think and you manifest whatever it is that you want. Like you're calling it into your universe. Like that's going to be really difficult for somebody with OCD, right? Listen to your gut, listen to your gut instinct, or, you are your thoughts. So, but life is so complicated, right? Like we're constantly getting inundated with this recommendation and this recommendation and this recommendation. And OCD is just such a jerk. It's like, there's one solution out there that's going to make everything so much better. And it just like, it like overly simplifies things. Like life is just not that simple. Life is just not that simple to be able to find the one key to fix your gut so that you never have to feel anxious again and never have to be depressed again. Like it's just, life is just not that simple. And OCD wants you to believe that so that you can pursue it, but it's just never that simple.
Also, that's very like needle in a haystacky, but the haystack is the entire earth. Right? Like if you think about it, like if there's one answer for healing your gut or healing your whatever, what if that one answer is in a rural village in India and you live in Kentucky? Like, what are the odds that you're ever going to make it to this rural village in India and like talk to the one person who knows the one herb that only grows in that town? It's like, yeah, that feeling or that illusion that there's like one key or one silver bullet or one thing that's going to help you is really freaky if you think about it, because it starts painting this picture of like, I'm never going to find it. This earth is too big. It's too vast. I'm never going to be able to search every corner of the earth and get this answer. So it's kind of like depressing in a way to even think that way. It's much more freeing to think that there's multiple angles and multiple like answers that could get you to the same place.
and that like we're all in it together, like unrelated. I never really had too many issues around my body, but I was always very obsessive and compulsive about my son dying before me. So I was relentlessly searching the internet for like the first 2 years of his life. I was basically planning his death. I was looking up TED Talks of women who had lost their babies so that I like knew that there was some semblance of a future for me, that I just wouldn't be left in this misery endlessly and my life would be over. Like I was Googling statistics about like what happens to moms when they lose their babies. And I like really thought, I really was convinced that like there's some way for me to know 100% for sure that he won't die before me. Like there's something out there that I was pursuing it. I was running after it. Like I was on the hot pursuit of this information, this silver bullet, this website, this statistic, this whatever. And when I realized that I would never have that, one, I had to mourn that, right? Like I had to mourn that, like, oh my gosh, like literally whatever I do, I have to live with that reality that like he could die before me. Like there's no way that I will ever be able to be 100% sure about that. But I also got to like stop holding my breath. Because it's like you have to deal with that. Amy, you have to deal with that. Everyone listening has to deal, like we all have to deal with that. OCD often makes us feel like, oh, there are all these legitimate fears that everyone else has, that like you're going to embarrass yourself at a party, or that you're going to be really uncomfortable and not be able to handle it. But if you do this ritual and this ritual and this ritual and this ritual, you're going to be safe. If you look up all the TED Talks about moms who lost their babies, if you keep Googling, you'll be safe and you won't have to deal with your son dying before you. And it's like, no, like literally nothing that I do is ever going to keep me safe from that, because that's just life. I'm never going to be able to be 100% safe from that. So it's like very hard in a way, but you also get to stop holding your breath. Like that the thing that you're searching for, it's like the Wizard of Oz, right? Like it looks like it's this big, thing, and it's like very powerful and something like it's just like this huge thing. And at the end of the day, you pull behind the curtain, it's just like this teeny tiny little entity.
Right.
That promise never existed.
Yeah. Well, and again, I know too, like with OCD, sometimes like the CBT can be problematic, like kind of traditional talk therapy. If you're trying to kind of dig into the meaning of some of these fears, can be very problematic for someone with OCD versus, again, just labeling your thought as crackhead Steve. Like, again, that's one thing versus trying to dig into why crackhead Steve is yelling at you like crazy stuff. So talk a little bit about that, like why, or again, like if you've been to therapy and it hasn't worked, like why CBT hasn't worked. And then again, like talk about exposure prevention stuff.
Yeah, so OCD, as we are coming to learn, is super nuanced. It is highly unique. And so for that reason, and I would say for all disorders, right? For if you're struggling with depression, if you're struggling with post-traumatic stress disorder, you should be getting and providing evidence-based treatments. So these are treatments where you're not just going into a therapist's office and they're just throwing whatever feels good at you. They're just with their own like level of creativity, just providing whatever they think is going to work and hoping that something sticks. They're actually being guided by literature and evidence, and some type of structure that's been very rigorously tested. And so there are lots of evidence-based treatments out there for a variety of different conditions, right? But for OCD in particular, exposure and response prevention, otherwise known as ERP, is just the most robust. It's been around for a very long time. Research shows that ERP is more effective for OCD than any other condition, than any other treatment for any other condition. So it's just very robust. There's a lot of research behind it. So the reason why the difficult thing is, and the confusion is often that ERP is a type of CBT. So CBT is just an umbrella term. CBT is just a very generic term that basically says, yep, this intervention or this therapist acknowledges the relationship among behaviors, thoughts, and emotions. So it's not like psychodynamic or Freud where they dig into your subconscious and your dreams and stuff, right? So CBT is just a super generic term.
Right.
And underneath that umbrella exists other CBT-based interventions that are more specific, like ERP. There's also dialectical behavioral therapy, which is very effective for personality disorders and emotion regulation disorders. There's also behavioral activation, which is an evidence-based treatment for depression. So all of those exist under CBT. The problem with getting CBT for OCD is that it's you might be getting treatment, but it's not ERP, right? So you might be talking to someone who's, doing thought challenging records with you.
Right.
That's CBT. They're acknowledging the relationship among thoughts and behaviors and feelings. But to do a thought challenge record with somebody, like challenging the logic behind their obsessive and compulsive thinking, we've just decided, right? We've just discussed, like, you're not going to be the lawyer against Crackhead Steve. That's not effective. If anything, not only is it not helpful, it can actually be detrimental because you're just feeding the fire, right? Like trying to logic your way out of OCD. It's just kind of like throwing logs on the fire. So yeah, like in CBT, traditional kind of like talk therapy that I'm referencing, you might talk at length about a thought, like, well, let's like really try to understand why and where this obsession with your son's death comes from. Do you ever remember feeling that way as a child? Where else has this come up in your life? And it's like, some people, for other conditions, that might be helpful. For depression, I'm not an expert in that, might be helpful. For trauma, might be helpful. For OCD, what that does is it just elevates the level of importance of that thought. It highlights how important it is that I'm having thoughts about my son dying. When really what I need to be acknowledging is that this has nothing to do with my son. It's the intolerance of uncertainty. It's just coming up in the form of my worst fear, right? Like, I don't need to understand why. I need to understand what I'm going to do about it, right? So, and things like journaling, right? Like that can be helpful for other conditions. For people who have OCD, it might just be written rumination where they're just sitting there. I'm so upset. I can't stop thinking about my son dying. If he died, I don't know what I would do. What am I supposed to do if he dies? I can't let that happen. I would be so. Where does that get me? Right. And so what we do instead is exposure and response prevention. It's a very behavioral intervention. It's very much focused on, like, what do we do about it? It's very much focused on not engaging with the thoughts. And so the same way that you're like, yeah, hi, Crackhead Steve, and you continue to do what it is that you're doing, that's very like what we would call a non-engagement strategy in ERP. But ERP is really the gradual and collaborative approach of, I see it as like three things. So we work on having you expose yourself, gradually put yourself more and more outside of your comfort zone. So going to the parties, even though you're uncomfortable, gradually trying to get more implemented back into playing basketball, eating fear foods. These are all great examples that we've discussed. But then the second part would be to reduce safety behaviors. So you can go to the party all you want if you just stay in the bathroom where you feel safe. That's not okay. Like, that's not helpful, right? Yeah, you can eat that trigger food or that fear food as long as you are asking your husband every 15 minutes to, if you're okay, right? That's not okay either, right? Like, we need to do the scary thing and reduce the compulsions and reduce the safety behaviors that we're used to doing. Otherwise, it's like somebody trying to touch something dirty with contamination fears and they just get to wash their hands after. There's nothing that's different about that situation, right? That's what they've been doing. They've probably been going to parties and hanging out in the bathroom. They've probably been eating triggering or difficult foods and then asking for reassurance or monitoring their body and jumping onto Google. We need to do something different, right? And so we do that by reducing the compulsions. And then the third is related to that. We just want them to reduce avoidance. So I always start first with, what are the things that you're avoiding? Are you avoiding going out to eat? Are you avoiding going to parties? What are the things that you are avoiding that you want to get back into? And then we find ways to gradually, in a way that's challenging but manageable, and in a way that's hierarchical, we kind of work up to those things that are challenging but manageable for them. So yeah, it's really effective. Like I said, it is more effective for OCD than any other treatment for any other condition. And a lot of people are very scared of it. Like, oh my gosh, they imagine having to do like their worst fear ever. It's not like that at all. Like I said, I didn't just like give this girl that I worked with Domino's pizza. We drove to Whole Foods and we got like the next most appealing thing. It was anxiety provoking. It's different, right? So it's never going to feel good. It's never going to feel easy. But neither is continuing to live life this way either. So yeah, it's hard, but so is living with untreated, OCD, untreated symptoms in general. So it's really amazing.
And that's such a good point to say, like, it's never going to feel good, but that's okay. That's part of the process. And like, we actually talked about that a long time ago, but in a completely different context where it's like, all right, if you've been low FODMAP, which is a popular diet for IBS, like, let's say you've been on low FODMAP for 2 years. You haven't looked at an onion or a piece of garlic or an avocado or an apple in 2 years. And then you start reintroducing foods. I feel like it, and I know Amy agrees with me, I feel like it's perfectly reasonable / expected that you're going to feel some gurglies or some gas bubbles, or your poops might change a bit. Like,
because you're doing something different.
Well, you're doing something different, and like, your microbes haven't seen that food in 2 years.
Right.
They probably forgot that garlic existed. So the microbes are scrambling in there like, what the fuck? How do we digest it? This is awesome, but we have to figure out how to do this again.
Right.
So we were saying, when you're reintroducing foods, it's okay if you have like a 10, 20, maybe even 30% bubbling up of some IBS symptoms. Just kind of take a deep breath and try again and see if it gets easier with time. But
and try to live with that, right? Like, I think something, Amy, that you mentioned was like that you like continued to pursue your values. Something that we hear a lot of in our field is like sit with the uncertainty or sit with the discomfort. I actually really like the concept of acting with uncertainty or acting with discomfort, right? So like, I wouldn't want somebody to be sitting there with their gurgles and just like perseverating on it and just thinking about it and ruminating about it and canceling their work that day because they don't feel well and did it like, no, I need you to show yourself and give your brain the experience and demonstrate to yourself that you can handle the gurgles. That you can go to work and that you can handle this. Because at the end of all of this, regardless of what someone's presentation is, regardless of where they're coming from with anxiety or OCD or whatever, I think so many of us can resonate that our fears always land at the core of, I can't handle that. Right? Like, oh, if I have gurgles and then it's going to bubble up to this and it's going to be this and it's going to be this and it's going to be this and I can't handle that. If I feel a certain way and I go to this party and I have diarrhea and this is going to happen and this is going to happen and this is going to happen, I can't handle that. The reality is that might be awful. That might be ugly. That might be really embarrassing, but you would handle it. You've handled literally everything else that has ever happened to you. And so, physical discomfort, it's going to be unpleasant. You can handle unpleasant things, right? And of course, everybody has a certain baseline, right? Like, I would never send anybody to work while they're puking and getting violently ill. But yeah, you do need to learn that like you don't need to feel 100% perfect, even 80 or 90% perfect in order to go and do the things that you need to do in your everyday life and to live a life that's worth living.
Right. Well, and I think too, like, it's interesting because I'm going through like ERP now. And I think like the thing that I feel was like, at the beginning of exposure or like kind of doing more of the things or having the intrusive thoughts and not engaging, like, again, not doing the safety behaviors. Like, I feel like you could have almost like 8 or 9 out of 10 like anxiety from just being like, okay, crackhead Steve saying some really like crazy, scary stuff, but I'm not gonna engage. And that again, like, provokes a big discomfort or an anxiety where it
feels irresponsible.
Right. And then, but again, over time, what I've kind of found is like the thoughts have decreased in frequency, and so has the discomfort of the same thought. And the ability to re-engage is much faster. So it's like, maybe the anxiety, if a thought comes up, is only like 2 out of 10 now, and you can easily say, oh, that's an intrusive thought. And then you can kind of move on way more quickly than before. That's kind of what I would say ERP's like been like for me, where at first it's like, whoa, this is like pretty intense. And then it just gradually kind of goes down over time to where you're like, oh, the thoughts are more in the background and further away. And again, like the anxiety and the ability to move on is much swifter than kind of peak OCD for me. Is kind of what I've noticed.
Right. And that should happen.
Right.
That's what we would expect. So really the mechanisms of change there, we would say is one, habituation. So you essentially just get used to it.
Right.
So this idea of habituation, we all habituate. It's the same reason why when you get into a cold body of water, it is really cold at first, but eventually it gets warmer. Our bodies, without us even having to do anything about it, are always driven to maintain balance, right? That's why when we sweat, we shiver, or we sweat. It's why when we're hot, we sweat so that we cool down, and when we're cold, we shiver so we can warm up. And the same thing happens with anxiety, right? So when you're looking at this stimuli, that's an 8 out of 10 level of anxiety, and your body's ramped up, and it feels like there's a threat, and your brain literally doesn't know the difference between a rattlesnake and a hose, right? Like it doesn't know the difference. It's reacting the same way regardless. But if anxiety is also really exhausting, your body doesn't have like the gasoline to perpetuate that for very long. And so if you just continue to stay in the water, or continue to look at that rattlesnake, or continue to do that exposure, Amy, like you're talking about, you will eventually calm down. It's just so often that we try to calm ourselves down by logicking our way out of it, by doing a safety ritual, by doing a compulsion or whatever. And essentially what we're doing there is we're jumping out of the pool. Yeah, you might be warmer now, but you didn't get used to the water, right? So like, so you are demonstrating habituation. So not only are you getting used to it in that moment, but over time, you're also getting more and more used to it, right? So, the first time that you interacted with that trigger, it was an 8 out of 10. After you've done it repetitively and for a prolonged period of time, it's now a 2 out of 10. And that's very, very normal. But also what's happening in the background is it's called the inhibitory learning model. Consciously or not, by doing these exposures, you have learned, I'm still alive and I don't need to do my compulsions. I don't have to engage with my thoughts in order to be okay, right? Like the world keeps spinning. I haven't done my compulsions and I'm still there. Because, when we do those compulsions, unknowingly or not, we're telling ourselves, good thing you didn't go to that party because otherwise you would have gotten diarrhea and you wouldn't have been able to handle it. And it's like, by doing compulsions, we only ever reinforce the worst case scenario. We never give ourselves a fighting chance to learn that something else could have happened. Right. Yeah, it's so interesting. I'm curious too, like, because we talk a lot about just like lifestyle stuff too. And again, not wanting those things to be necessarily like a compulsion or anything. But one thing that I have noticed that generally the sleep, like getting enough sleep, which is hard when you're a new mom. Like I'm not obsessive about it or anything like that, but trying to get enough sleep seems to be really important for me in particular. And then eating regular meals as much as possible. Again, like I'm not obsessive about it, but I will say that those two things seem to like intensify the underlying anxiety for me a bit. I don't know if that's something that you've seen, but I will say, I know I've talked about it with my therapist, is like, on weeks that I get a little bit less sleep, or again, like my meals are thrown off because I'm traveling or something like that, I think the level of resilience to engage in the exposures, or again, like engage in being comfortable with the anxiety, maybe goes down. I don't know if that's something that you've typically seen or not. For sure. I mean, to do this work, it takes mental resources for sure, right? And so when we are already depleted by our kids or life, or not eating, quote unquote nutritious food, we only have so many. I think that we all start the day off with a mental energy piggy bank, and some days there's a lot in there, and other days there's not a lot in there. That's why by the end of therapy days, when I go to get my son, I just want to bring him home and watch Bluey for the rest of the night. Like, I don't really have a whole lot in me to do very deep, meaningful play. Right. Like versus the weekend, I'm like, I'm all yours, buddy. Right. So yeah, I don't think that's, I think that's just a human thing, that we all have a mental energy piggy bank, and that when we're tired and we have a baby to take care of, and we have even if it's just like a bad day at work, right? Like we're not We're
Right.
human. Like, of course we can't be, of course we're not going to perform at our best when we're not feeling our
Right.
best. That's totally human.
Right. Yeah, for sure. For sure. Yeah, I'm trying to think of, we've covered so many bases. Nikki, do you have any additional questions?
Not questions. I'm just sitting here noodling a lot, but I think my brain keeps going back to this idea that you don't have to be perfect. You
Right.
don't have to do something 100% of the time. You're going to have good days and bad days. And like, again, like circling back to reintroducing foods, like there will be days that you reintroduce a new food and you feel some bubblies or maybe you have some loose stools, and that's maybe okay and to be expected. Or you might have those days where you really, really want to go back to that Facebook group and research that new antimicrobial that you heard about for SIBO. And
Right.
yeah, I think just knowing that that's okay, but trying to like get on top of it more often than not. I was close to having a thought there and then it kind of drifted away from my brain again. So sorry if that's a little discombobulated, but yeah, sorry.
No,
I was
you're-
close. If it comes back, I'll let you know. But I think I was circling back to a patient I met with this week. And the only thing I could think of to share was that we had talked about like mental health and anxiety playing a role for her to some degree. And as one example of like crackhead Steve for her, she mentioned a new supplement that another provider had recommended. And she started really cautiously, like one capsule a day. And she said in her notes for the appointment, she said that she hadn't taken more yet because she was afraid it would damage her kidneys. And my brain, I went, I don't remember her having a kidney problem.
Yeah.
And I went back through my notes and I didn't see anything about kidney problems. And when we were in the appointment, I asked her, I said, now you mentioned that, like, what was the genesis of that thought? And she said, oh, I Googled it and found that. And I was like,
Yeah.
And we actually got talking, and this is a patient who had been diagnosed with anxiety for sure. But I actually asked her, I said, remind me, like, have you ever been diagnosed with OCD, or has that ever come up? And she's like, oh yeah, I've been diagnosed with it. And she has more of the physical compulsions. And I pointed out, I said, yeah, like Amy's actually been teaching me a lot about this and how it can actually be affecting some of what we're kind of working with your health. And there might be some health related OCD. And this is one example of that, is like kind of starting a new supplement, but Googling every worst case scenario of that supplement and then being scared to death to get up to the recommended dose of the supplement because and she had this epiphany and she was like, wow, oh yeah, like I never once thought, like nobody ever pointed out that my OCD could be related to like my health. So people have been working with her in some professional capacity on like, checking the door 100 times a day to make sure it's locked.
Right.
But nobody has had the conversation yet about like food fear. This lady has a lot of food fear, and she's another one who wants a test. Like she wants to retest certain things very frequently, and like Googling obscure things like this supplement maybe theoretically in some universe could damage the kidney of one person one time.
Right.
So it's interesting. Like now that I know enough to kind of point that out gently to some people, like having a few people go, oh, I never once thought it was related to my gut or the nutrition stuff or the food fear. And
a lot of times people that's my problem with the subtypes,
Right.
unfortunately, is that like, yeah, we use these subtypes, but then we get so constricted by the subtypes. We feel like that's all that exists.
Right.
And then we fail to look more abstractly. So yeah, the subtypes are great because I do think they like pull people in and people resonate with that term of like health OCD or postpartum OCD or contamination OCD, sexual orientation OCD. But at the same time, it's like we can't just go off of that because OCD is OCD, right? Like we have to be able to look at the big picture. And if you're obsessing and you're compulsing over food, I don't care what you call it, it still could be obsessive compulsive disorder. And I would still want and hope for somebody to do ERP around that.
Well, and one other thing too, like, what is the scale? It's like Yale. It's like a Yale form.
The Yale Brown Obsessive Compulsive Scale. It's the Y box.
Like, again, I would definitely say if you feel like you have like health OCD to definitely work with a therapist. But I don't know if you can like look that up online, like if you were just curious to go through it, or is that something you would recommend?
Yeah, so there are lots of different like diagnostic things that you could do. I mean, you could certainly self-diagnose, but obviously to have something like on your medical record, you would need to work with a professional. But yeah, so the Y box, it's the Y-BOCS. That's the Yale Brown Obsessive Compulsive Scale, but there's also several others. There's the DOCS, the Dimensional OCD Scale. We at NoCD, we actually use something called the Diamond Screener. It's free. It's a very thorough screening questionnaire and tool. And that will take you through. But even those, right? Like it asks you about like scary thoughts. It asks you about contamination. It asks you about rearranging and ordering and, sexual intrusive thoughts. And you really have to work with an expert who understands that OCD is only limited by your imagination. Like there's no reason why food couldn't also be one. Right. So as long as people just be aware that these subtypes are helpful, but OCD can latch on to anything.
Right. Anything that you value.
And it's more so like a way that someone is living. Yeah. It latches on to what it is that you value.
Right. Cool. Yep. Well, and
another.
Go ahead, Nikki. Sorry.
Just another thought too, like going back to latching onto something you value, and kind of my mind went back to testing. And again, like the people who maybe have a wish list of tests that they want to do. And it's not uncommon because like people are frustrated with the medical care that they've received up until this point, or like their GI doctor. But, I think on some level, every person craves data and like objective data.
Yeah.
Like, oh, this is printed in black and white on a sheet of paper. We know for sure. We've got the boogeyman. We've got the right label. We've got the right diagnosis. I think everybody craves that to some degree. But I'm starting to fathom that people with OCD crave that a lot more because, again, they want the answers. And what sucks, and I find myself saying this in, my appointments with people and platforms like this on the podcast or YouTube, I find myself wanting more and more to shout from the rooftops that there's no such thing as a perfect test. And that's really, really important to know. So like even recently I posted about SIBO breath testing being really, really, really imperfect.
Right.
And it's like, I think a lot of these tests have a time and a place and they can be helpful, but never take a test as the gospel and give yourself permission to ignore your body, right? Like if you have a SIBO test that's negative, but you have all the symptoms of SIBO,
right?
I don't know, like maybe you could still manage it as though it were SIBO and feel better. Like maybe it was a false negative. Similarly though, like if you had a SIBO test that was positive, even though you just did treatment and you feel 100% better and you were just doing this test to confirm that the SIBO is really gone, like, what are you going to choose? Are you going to trust the fact that you feel better, or are you going to trust this piece of paper that may or may not be accurate? But I think that that's a hard pill for people to swallow, but particularly if they have a lot of fear of uncertainty, is like the things that on black and white on a piece of paper feel like the truth.
Right.
And in reality, they never will be the truth.
Right.
Like not 100% at least. They could kind of point you in the right direction and then give you the opportunity to listen to your body. But you still need that second part of listening to your body to really come to any worthwhile conclusions.
Right. Well, and again, like, but even then, sometimes your body's like betraying you, and somewhat with OCD, like if you're getting sensations that you're reading more into, again, I think there's like a limit to that. Like somewhat to where you don't want to be hyper vigilant about, which I know we've talked about during this session too. Oh. But yeah,
you just reminded me of the thought that flew out of my brain, I think. So thank you. The hypervigilance thing. I think, and again, like probably the internet is somewhat to blame for this and somewhat the functional medicine kind of community, but there are so many different ways that people have been taught to overanalyze the shit out of their body.
Right.
And again, like being hypervigilant. So again, I remember when I did my training with the Nutritional Therapy Association, like they taught us a test where they, you have the client eat a food. No, you take your pulse first, sorry, and you count your pulse for a minute. Then you eat a food, and then you check your pulse every 5 minutes for the next half hour, whatever it was, 15 minutes. And if your pulse rate goes up by X amount, then that's like a food allergy or a food sensitivity, and you can't eat that food again. And I remember even at the time, I was like, I don't really like that. I feel like that's a little bit too much, and people are going to get weird and obsessive about it. And I don't even know if it's accurate. And I'm just going to not use that tool. But it's funny because on the flip side, like we tend to hang out with people who are really, really into health and like obsessed with health and nutrition. To a point where, we have the people who won't eat anything if it's not organic and grass fed and farm raised and farm to table and all that stuff. But then if you hang out with normal people, quote unquote, normal people, you realize that normal people are out there swilling gallons of soda and eating donuts for breakfast and eating a lot of like what you could call junk food. And they're still walking. Like they might not be in perfect health, but they're still walking around and they're doing okay. But what's weird is like, I think that people sometimes get this disconnect in their brain because it's like, I'm doing all these things and I still feel like crap. And then I see, my Uncle Bob, and he's eating donuts for breakfast 5 days a week and he's still feeling okay. Why do I have to struggle with this? But also like, you might observe Uncle Bob who eats the donuts for breakfast and then he crashes and burns and needs a nap by lunchtime. And to us, like people who are in the health space, we might think, oh, it's really obvious that Uncle Bob's blood sugar just went wackadoo, right? Like the donuts brought the blood sugar up and then it brought it crashing back down. Why does Uncle Bob not see this? Like if Uncle Bob could listen to his damn body, he would realize this very clear pattern. And I feel like on some level, this was a very roundabout way to get here. I feel like people are maybe afraid that there's a pattern that they just haven't seen yet. And it's not obvious to them yet, but if they pay attention enough, they will pick up on stuff like that. And sometimes I think that we compare ourselves to like the people out there who have like the scenario like I painted with Uncle Bob, but they start getting more and more granular, looking for more and more obscure, minimal stuff. Like again, like, oh, I had lemon water and then I had one sniffle, and it's a histamine reaction. Like, I don't know, is it like the difference between that and like Uncle Bob's blood sugar crashing and needing a nap? Like they're pretty different scales of severity. I don't know if that all made 100% sense, but thank you for my TED Talk of circular logic. But hopefully I got something out good in the process.
Well, yeah, I think that you're saying that like, I think it comes down to the doubt situation. Like again, you think, oh, I just need to find that one pattern that I haven't found before. And that's sort of where the doubt comes in with the OCD.
Like I'm going to have the epiphany. Like one day Uncle Bob will notice that he always needs a nap after getting Paula's donuts. Right. And like maybe one day I too will put 2 and 2 together that I always get itchy after I eat green beans. And therefore it's the green beans that have been causing my IBS all along. But again, it's like there's like the ability to recognize patterns when they're really in your face. And screaming at you. And there's the ability to recognize patterns when they get really granular and detailed. And I tend to not think that those like little granular detail-y things are real patterns. Another way to think of it, like from a math standpoint, is that there's no matter what data you're collecting, there's always going to be some degree of variation in the data, like noise, statistical noise. Like you being a little bit itchy or not itchy, or you having a little bit of phlegm or not having phlegm, or a little bit of gas bubbles or no gas bubbles, like that's still in that realm of normal, probably for you. Right. Like it's like that's statistical noise. Like on a day-to-day, you would fluctuate from here to here anyway. So we can't make a mountain out of a molehill when it's that kind of level of data. But again, Uncle Bob, like on the days that he goes and gets two donuts for breakfast and he always needs a nap around lunchtime, And then on the days that he eats like eggs for breakfast and he doesn't need a nap at lunchtime, like maybe like that's enough of a swing. That's enough of a difference that it's no longer in the realm of like what could be considered normal. Like it's no longer statistical noise.
Right.
It's actually something that's relevant that Uncle Bob maybe should pay attention to.
Right. Like there are true patterns that will affect health, but then I think like the OCD stuff is just you go down a rabbit hole of trying to find every little pattern of, okay, we have clients that are like, oh, if I'm bloated, I have SIBO. And it's like, well, normal people bloat. And so like, again, that's not necessarily a pattern. You ate a little bit differently. That's not anything really to pay attention to or to overthink. But again, when you're in the OCD space, you, I think, overthink every little detail or misread things as important when they're not. But yeah. All right. I know too that I want to make sure that we highlight again the resources because I feel like we've covered a lot. I know that you have a podcast, which I really like. I've listened to a number of those episodes. It's All the Hard Things, right? Is that right?
Yep. So it's called All the Hard Things. It's on all podcast platforms. A little bit of OCD stuff, lots of exposure and response prevention. But if anyone resonated with just like the anxiety discussion and anything that we talked about, I think it would be really helpful.
Like there's some people on there too that talk about health anxiety, health OCD in particular that could be relevant. And then again, your Instagram's really great. Is it treat your OCD? Is that the Instagram handle or is it no CD? And now I'm confused.
So my Instagram handle, like we talked about, is Jenna.Overbaugh. But another really good resource on Instagram it's at Treat My OCD. So that's the no CD Instagram. The OCD community, education wise, on Instagram is just really solid. Obviously, I don't participate too much in other niches, but I'm biased, so I'm a little bit biased, but it's just really solid. Lots of really great evidence-based education, really supportive, really tight-knit community there. So yeah, I also always encourage people to check out the IOCDF. It's the International OCD Foundation. So you can find that at iocdf.org. And then, if anybody out there is, wanting to pursue more therapy, go to www.treatmyocd.com. But even if not, there are so many free resources on the app, lots of great community there, support groups if you do therapy. So lots of really good stuff.
Yeah, no, I found, again, both your Instagram and then the at Treat Your OCD Instagram, because you're on there a lot too. So I feel like I get like a double dose. A double dose of Jenna on some of the Instagram stuff. But it's like super helpful tips each day that kind of pop into my feed. But yeah, those are great resources. And again, I think you could go to, if you like weren't sure, if you like would, quantify as OCD. I certainly would, if you really think you have OCD, work with a professional. But like, again, the website Treat Your OCD has so many great resources on it too to help maybe like give you slightly more of an idea if it's something to explore more or not. But yeah, no, this has been awesome. Is there anything else, Jenna, that you want to say or highlight before we hop off?
Yeah, no, I mean, I think this was great. I think the biggest thing other than the resources is just knowing that OCD can latch onto anything. And so don't be fooled by the subtypes that are out there. They exist for a reason, for that building of community, but by no means are they supposed to be meant as like an exhaustive list. Really would encourage people to think more abstractly and think about the condition and the patterns that they're seeing in their own life. But also know that it's very treatable. Like I said, this is extremely treatable. It doesn't have to be that way forever. And I think everybody can benefit from some aspect of these skills, right? Like, I think everybody can benefit from doing things that are scary and relinquishing the behaviors that they think are helping them, but aren't actually helping them. So by no means do I even think that this is like an OCD specific intervention. It's like, this is great for everybody. Like, I try to do this with my kid. I try to teach him, like, we ran a 5K together the other day. He did like a different version of it. But he really wanted to go and get an extra bag of chips at the end of the race. And he was a little bit like shy about it, a little bit nervous to go, but I really encouraged him to go up by himself and ask for it. And he did it. Like, what would I have been doing it would have been so much easier for me to just go and do it myself. But now he's like building the experience that he can ask for the things that he wants. And that's not scary. That's not so scary that mom has to take over. So it's more of like a lifestyle. So yeah, I'm biased, of course, but I think it's really great.
Yeah, no, I think you're dead on. And again, I think too, like, just in terms of my experience, like, I'm trying to think when I went to therapy, it was around like my 8-week postpartum. Now I'm like 13-ish weeks. And just like, even in that short period of time, seeing like a lot of results. And again, I don't think everyone is going to be like, in that short of a time have maybe the results I had, but just like what you're saying, there's a lot of hope. And I think that the treatment really does work for most people. And it seems like it's worked for me in a shorter period of time. There's still things I'm kind of sorting through and working through, but like, I'm really pleased with the work that I've done so far. Yeah. All right. Well, do you want to wrap us up,
guys?
Nikki? I feel you're always.
I was going to say, I'll close us out since Amy gets to be an awkward turtle when doing the intro and the outro for the actual episode. I'm awkward too, but I just embrace it at this point. Like, that's the difference. But yeah, guys, thank you for listening to, again, your favorite podcast. I know it. You just admitted the IBS Freedom Podcast. As always, if you're on YouTube, drop us a comment, like the video, do all the things you would normally do on YouTube. If you're on Apple Podcast, we would so deeply appreciate a 5-star review. And as always, we will see you back here next week for another awesome topic that will hopefully help you heal your gut and feel in tip-top shape. And we'll close out the new year before you know it and continue on with season 2. So thank you for listening, and we will see you next week.